The following video will introduce the products in the Allen Spinal Suite. The setup and adjustment of each product will be demonstrated, along with suggested techniques for transferring and positioning a patient. The Flex Frame is an OR table extension. It serves as the platform for the rest of the product suite. All products used on the Flex Frame are compatible with the Jackson table. All of the products are rated for a 400-pound patient. However, if the OR table has a lower rating, then the Flex Frame and accessories default to the lower weight rating. All products should be cleaned thoroughly after use using a quaternary amine solution or other non-bleach disinfectant. Disinfectants should not be poured onto the products. Instead, products should be wiped with a damp cloth, removing any excess liquid. See the instructions for use document included with each product for further details. Begin by setting up the OR table. Remove the head section and orient it toward where the Flex Frame will be placed. Drop the foot section as far as the table will allow. The Flex Frame should only be attached to the back or seat section of a table, never the head or foot section. You can use the spinal leg pad in place of the standard OR table pad, if you choose. Move the table down the room to make space for the Flex Frame near the anesthesia cart. Lock the table. Make sure that the floor locks are in good working condition and that the floor is level, clean, and free of debris. The Flex Frame is only as rigid as your OR table. Try to use the sturdiest tables in your facility when attaching the frame. Position the Flex Frame so that it is about 4 feet or 1 meter from the end of the table. Remove the clamps from the handlebars of the frame and slide them onto the rails of the table. The clamps should protrude past the end of the table about 4 inches or 100 millimeters. Make sure that the clamps are even and that they are seated properly on the rails before tightening. Stand behind the frame and put one foot on the base. Place your palms against the top of the frame and press forward on one side to walk the pin out of the hook. Now press on the opposite side to remove the second pin. Slowly lower the frame down and let it slide along the floor. Keeping your back straight, bend your knees and lift the frame up. Rest it on the end of the table. Drop the pins into the clamps. You should hear a click as they fall into place. Slide the teardrops flush against the clamps so that the frame is secured laterally. Tighten the knobs. Both teardrops must either be on the inside or both on the outside of the clamps. Experiment to see which configuration will work best with your OR table. Lower the frame until it is level with the table. Check the bubble level near the handle crank. If the bubble is not centered, you will need to adjust the position of the base. To move forward and backward, place your foot behind the wheel axle and slide the base by pushing or pulling with your foot. To move side to side, place your foot on the inside of the base and pull towards you. Recheck the bubble level. When the bubble is centered, the base is in the proper position. For extra stability, you can lock the base of the frame. However, it is not required for the safe and effective use of the system. The setup process can be modified for 2 people. When removing the Flex Frame from the OR table, make sure that the base is unlocked. Bring the frame to its maximum height. Slide the teardrops away from the clamps. Lift up on the latch and pull the pins out of the clamps. Keeping your back straight, bend your knees and bring the frame to the floor. Place one foot on the base. Lift up on the handlebars and slide the pins into the hooks at the base of the frame. Remove the clamps from the table and store them on the handlebars of the frame. The breakdown process can be modified for 2 people. The flex frame doubles as a storage cart. Most of the accessories can be stored right on the frame for easy access. The wing set system supports the patient's torso in the prone and lateral positions. It consists of a hip piece and a chest piece. Each piece is unique. The label on each latch indicates the proper orientation. The figure's head should be pointing in the same direction as the patient's head, and the solid colored quadrant differentiates the hip and chest pieces. If everything has been installed correctly, the wing sets should form an O. To release the wing set latches, press down on the white button with your thumb and pull back with your fingers. The angle of the wing sets is adjustable. With one side latched, slide the other side along the frame. Close the latch using the heel of your hand. The latches might be a little stiff at first. Open and close each latch several times to help break them in. The width of the pads is adjustable. Flip the white lever down to slide each pad in and out. Flip the lever back up to lock. The wing set pads should be located to support the patient's bone structure. You can remove the chest block to avoid sternal compression. Removing the center pad also allows the width to be adjusted for pediatric patients and those with smaller frames. The wing sets should always be used with a covering. The Allen comfort covers were specifically designed for this purpose. They are single-use covers made from latex-free polyurethane foam. Turn the covers inside out so that the patient will contact the foam material. The covers should slide freely. This helps to reduce shear on the patient's skin. The C-prone is intended for non-rigid prone head positioning. Position the C-prone along the frame. Place the handle onto the stud and turn to release the mask. The mask can now move freely. Tighten the handle to lock the mask in place. Remove the handle after adjusting so that the mask cannot accidentally be released. The mask can also be adjusted laterally using the lever near the base. There is an adjustable mirror so that the patient's face can be monitored throughout the procedure. The C-prone should always be used with the Allen Comfort Mask. It is a single-use cushion made from latex-free polyurethane foam. Always check to make sure that you have fully locked the C-prone before preparing to transfer a patient.